Checking up on health concerns not only for men, but also some for women. We've got a urologist with us today from Mercy Health St. Rita's. We have Dr. Daniel Murtagh. Thanks for joining us.
Hi, thanks for having me.
Okay, first of all, some people think you're a specialist, but everybody needs a urologist in their life. Tell us why.
Absolutely. So, a lot of people think that it's a male-dominated specialty, which we see a lot of men, but everybody has a bladder. And so urology is an intimate specialty. We talk about a lot of embarrassing problems that people may have, and we understand what you're going through. And so everybody needs a urologist in their life at some point. And, we hope that you guys feel comfortable coming to us.
Yeah, as you said, it's embarrassing issues, but let's get started on maybe some of the screenings and things that we should undergo so we know to get the help that you can provide.
Sure, absolutely. Some of the topics that we cover in the world of urology, I think most people are familiar with the PSA screening. PSA is just an enzyme that the prostate makes, and we know it's not a good test, but it's the only thing that we have to screen for prostate cancer. And we want to pick up on prostate cancer as soon as possible. It's a spectrum of disease, and it should be something that, in this day and age, nobody should suffer with advanced prostate cancer. We want to find it early, treat it, and be done with it.
So that is one of those cancers that, as you said, get it early, that we have good outcomes for.
Absolutely. PSA screening should start about at the age of 50, unless you have risk factors, such as being an African-American gentleman and or having family history, which is pretty much the strongest risk factor.
Okay, so let's talk about blood in the urine. Sometimes people get that and they just push it off and say it's no big deal. So what are the concerns if you see blood in your urine?
Yeah, just like PSA screening, blood in the urine is sometimes an early warning sign for something going on. And I hear a lot of patients say, well, I had blood in the urine, but it went away. That doesn't mean that the problem went away. And so blood in the urine or hematuria is screened sometimes and found under a microscope. That's called microscopic hematuria. And then sometimes we see it in the toilet. And if that happens, you have to get it worked up. Just like if you see blood in the stool, you get a colonoscopy. If you see blood in the urine, you get a cystoscopy. And so you should see a healthcare provider, let them know what's going on, and make sure that nothing major's brewing.
If you do have blood in your urine, what are the typical problems that you find? Is it, kidney stones or something else? Or
Good point. It can be a lot of different things. It can be kidney stones. It can be, some infection. You can have inflammation, but it could be a tumor, and so that's an early warning sign. It could be in the kidney and or the bladder. So a workup typically involves an image of the kidney and a scope into the bladder, and then you're done.
Okay, so we touched on men's health issues. Just to make sure guys are getting everything checked out, check out the prostate issues. But what are other things that you can help them deal with and need to be checked out too?
Absolutely. The prostate has two, main problems to it that guys deal with. One, it grows too big and it obstructs the bladder. That's called BPH, or enlarged prostate. And then two, it can grow cancer, which we've kind of already talked about. The purpose of the prostate is help with conception. But after that, men typically have it grow throughout their lives because they produce testosterone, which is the food that feeds the prostate. It doesn't stop growing through your whole life. And if it squeezes too hard on that urine channel, it can really stress the bladder out. And some guys have really bad difficulty regaining function of their bladder later in life. And so you want to treat it early and make sure that it doesn't affect the function of your bladder.
Speaking of leaky bladders, that's men and women, right? And that's an issue that you see?
Absolutely. Leaky bladders. Just like men think that their streams are getting, weak because they're getting older, women think, oh, well, I'm getting older and, my bladder may be leaking and that's something that I'm going to live with. And it shouldn't be. Everybody should be dry and confident that they're dry. And there's many different therapies for, a leaky bladder or incontinence. And that could be medications. We have a great physical therapy department that really help women. And then there's also procedures that we can help you with that are office-based and more involved that may, require surgery or something like that. But it's nothing that you should be embarrassed with or deal with on a regular basis. Get that quality of life back.
And speaking of embarrassing, I assume for guys, it can be embarrassing to talk about erectile dysfunction, right?
Yeah. And in this day and age, it's more accepted. And in all honesty, guys come in and sometimes they bring their partners, which is great. And if you're suffering with erectile dysfunction, it is a totally normal part of life. And again, there are so many things that we can offer men and help you guys get back that part of your life that you're missing. It's a really important thing to, support that if you want to down the line. And we have medications, multiple therapies, and again, surgery that we can offer you. But it's really important to talk to a healthcare professional and have that, conversation about what we can do to help you.
And lastly, the one other subject, and this one's dear to my heart because I've had them many times, kidney stones. And you guys have a clinic then for kidney stones, right?
Yeah, something unique to St. Rita's urology department is that we have a kidney stone clinic, we call it. So if you have a kidney stone, come into the emergency room. We have set appointments held for people with kidney stones because we typically like to treat the stones if you need it within 24 hours. And so you will have an appointment set for you. You show up, we'll either treat it if you need it, whether or not that means you get the stone actually treated if we can, or if you get a stent that day, if it's an emergency, we usually take care of you within 24 hours, which is really nice for patients.
Yeah, that is a nice feature. Wow, lots of great topics that you brought up, Dr. Murtagh. Thanks for joining us today.
Hey, absolutely. Come and see us if you have any issues, and we're happy to help you out.
All right, thank you very much. All right, don't go away. New Edition continues in a moment.